Hemangiosarcoma or spleen tumors in dogs. This is what it is, and my most important natural remedies. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Hemangiosarcoma, it's a cancer of the lining of the red blood cells. It most commonly affects large breed dogs. Primarily, it's affecting the spleen. It can affect the heart, but can also show up in the skin. In the very first dog I had in practice, this was Hoochie. He was this awesome German Shepherd cross. He unfortunately died really young. He was only 8 years old, and he died of hemangiosarcoma. This is a picture of myself and Hoochie, and my first associate in practice, Dr. Sackney, and that was one of our hospital cats. And as you can see, that was a long time ago. I think that was 1999. But he died of hemangiosarcoma. I actually did surgery on him. I researched alternative options at the time. There was few to, if any, published. I'm just so glad now that there are a bunch of alternative options. I can share them with you guys. It's actually a tumor of the lining of the red blood cells, but because there is such a big vascularized portion of the spleen, that's the most common spot for it to occur. Secondarily, it can occur in the heart. Because it can happen wherever blood vessels are, that's why it can show up anywhere in the body. Clearly, there's a genetic correlation, and we see certain breeds, such as golden retrievers, German shepherds, labs. You need to be thinking about diet or some of the dietary factors, i.e., some of these toxins such as cadmium, heavy metals found within our pet's food. Things like glyphosate or Roundup being found in our dog's food. We have the local environmental toxins, things your dog might be exposed to, i.e. someone has decided they don't like dandelions, they spray their grass. Guess what? Your dog walks in it, he licks his paws, he's concentrating that herbicide in his system. Clearly that's making him far more likely to get cancer. And then some of the things veterinarians might be doing, i.e. giving far too many vaccines too often. This overstimulation in the immune system can result in things going sideways, i.e. you get things showing up such as cancer. What are the clinical signs? Well, they can be really vague initially, just may be presenting with the dog that's, just kind of weak. They're not acting themselves. I know when Hoochie first presented, I took him for a run. He seemed just a little bit slower. I'm like, I don't know what's going on. His gums maybe slightly pale. Did some blood tests. He was mildly anemic. That was it. In other cases, your veterinarian might palpate a mass, palpating the abdomen. The spleen is kind of tucked up along the left side. It may be that there has been some internal bleeding. You might actually see abdominal distension. Or you might see an acute case where all of a sudden we have this massive tumor rupturing in the spleen. You get all this bleeding internally. Your dog can just acutely collapse. And it's the form of HSA affecting the heart. Number one, you just might see cardiac changes. You might be seeing a cough. Your dog might not have a normal functioning heart. The last form of hemangiosarcoma will be in the skin. Essentially, it's going to like bleeding or blood blisters, different areas throughout the skin. That would be diagnosed with a biopsy. Some of the other clinical signs, similar to some of the other cancers. Your dog just may have a decreased appetite. He's less hungry. He or she may be lethargic. They just don't have the same energy. But in the case when they've got a spleen tumor that rapidly ruptures, you're going to see a dog that's going to have a rapid onset of collapse. You got this difficulty breathing, extremely pale, may even lead to sudden death. As far as going about a diagnosis, well, with Hoochie, I followed up with extensive blood work. We did x-rays. I was suspicious of seeing something enlarged on the spleen, and I could palpate what appeared to be a mass. Then next, I had him ultrasounded, and that confirmed it. There was an obvious mass on his spleen. But then to get a definitive diagnosis, it requires a biopsy. But you don't easily biopsy the spleen, especially if you suspect a splenic tumor. So with Hoochie, based on all those other clinical signs and what I saw in the diagnostics, I went ahead right into surgery. I removed his spleen. Then the mass, it was sent in for histopathology, and that confirmed the diagnosis, hemangiosarcoma. But if your dog is diagnosed with this disease, what are your options? Conventionally, well, number one, you have surgery. If it's on the spleen, ideally you're going to remove that spleen. But unfortunately, without chemotherapy, they say the maximum that our dog is going to live post-surgery, 90 days. Because in the majority of times it's been diagnosed, by the time it's diagnosed, the cancer, it's already spread. And unfortunately, that's what happened to Hoochie. Next, you have traditional veterinary chemotherapy. So if you combine surgery with chemotherapy, then you're looking at a median lifespan of about 6 months. Like still, it's not curative. You just buy a little bit more time, and then you also have to put your dog through chemo. A couple points I need to make. Number one, about 40% of bleeding spleen tumors, they're benign, they're hemangioma. But because they're internally bleeding, you need to go in and remove the spleen. But then that's it. You've taken away the source of bleeding, it's curative. And that would be definitely the best case outcome. But in hemangiosarcoma, I mean, that's cancer of the lining of the red blood cells. Unfortunately, that's usually not the case. And there are a large number of dogs that are just, they come into the clinic, they've collapsed. There's clearly that they're rapidly bleeding internally, just based on x-rays, just basing on doing abdominal tap, seeing all that blood. So you need to take them right into emergency surgery. There are some new conventional treatments coming out. Number one is called EBAT, Epidermal Growth Factor Biospecific Angiotoxin. It's a new drug that targets specific molecules within the cancer cells. It's considered relatively safe. The early clinical trials are showing a marked improvement in 6 months survival time, upwards of 70% of the dogs. Second, there's an ongoing immunotherapy study, i.e. they're trying to develop what would equate to a vaccine against hemangiosarcoma. So here what you're doing, you're using the immune system to target and destroy these cancer cells. This isn't yet approved for treatment, but when it comes out, I'll definitely let you know. Number one, this is Artemisinin. It's a studied and potent natural anti-malarial treatment. But there's been a bunch of new studies coming out on it now, and specifically they're looking at the benefits of using this for cancer. The way it's working is that it's actually selectively toxic to the cancer cells because it's targeting cells that are high in iron. Hemangiosarcoma, the cancer of the lining of the red blood cells, they have a whole lot of iron. They're filled with hemoglobin. So that's why this can be so helpful. Much of the preclinical, the anecdotal evidence, they're showing that it's slowing tumor growth and it's improving survival times. They're seeing limited to no side effects in dogs. They're also seeing that it works well in combination with some of the other therapies, even chemotherapy, radiation, some of the alternative options. We're looking at a standard dog dose of 5 milligrams per 10 pounds of body weight daily. If I knew then what I know now, I definitely would have put Hoochie on this, Artemisinin. Number two, the Chinese herbal combination, Yunnan Baiyao. Yunnan Baiyao is developed in the 1900s, and it's a combination of 5 different herbs. The most important one is called pseudo-ginseng. And this has been well studied. Probably its biggest thing and what it's most known for in veterinary medicine, it's its ability to rapidly stop bleeding. And one of the big side effects we're seeing with our dogs that have hemangiosarcoma is this rapid internal bleeding. And in fact, if you go to many of the conventional veterinary sites, the one alternative that virtually all talk about, it is this. It is Yunnan Baiyao. It's been used in literally thousands of dogs with limited to no side effects. It also appears to have anti-cancer properties. So especially the way Hoochie presented, the weakness, signs of showing internal bleeding, like of all the different things, no question, I would definitely have had him on Yunnan Baiyao. We're looking at standard doses of 1 capsule per 30 to 50 pounds of body weight twice daily. Number 3, an awesome medicinal mushroom. This turkey tail mushroom. Turkey tail has literally hundreds of studies backing its effectiveness. In fact, it's been so effective and it's so well used in Japan, it's actually considered a medicine. And if anyone comes in and they have colon cancer, they're also put on turkey tail. Turkey tail has clear immune boosting and anti-cancer properties. And in fact, a study at the University of Pennsylvania found that turkey tail mushroom extract actually extended the median survival time of dogs diagnosed with hemangiosarcoma. What's really good about it can be used in combination with other drugs. So if, say, for instance, your dog is also on chemotherapy, he can be on turkey tail. They're also finding when animals are going on turkey tail, they have a much lower chance of recurrence of the cancer. And there's virtually no side effects. I suggest a standard dog dose of 100 milligrams per 10 pounds of body weight daily. These are 500 milligram capsules. Tula is 20 pounds. Should be getting about a half a capsule once a day. Number 4, the cannabinoids, CBD, cannabidiol, and some of the other medicinal cannabinoids. This is Dr. Jones's ultimate cannabinoid blend for dogs and cats. The cannabinoids, including CBD, THC, CBC, CBG, CBN, they've been well studied for an array of the different types of cancers. They've been able to cause apoptosis, that's cancer cell death. They've been able to decrease neovascularization, that's new blood vessel growth. And that is the primary way that these hemangiosarcoma cancer cells, that's how they spread. By decreasing the growth of new blood vessels, you can really have a marked effect on decreasing that cancer. Many of the cannabinoids, they may do just that. And at the very least, they're great anti-inflammatories. They provide some awesome pain relief. They work really well with virtually all other drugs, minimal to no side effects. So taking that all into account makes huge sense to get your dog on a good quality cannabinoid supplement. There are many out there. This is one I recommend. It's our own supplement, Dr. Jones's Ultimate Cannabinoid Blend for Dogs and Cats. I'm looking at standard dog doses of 3 milligrams per 10 pounds of body weight twice daily, but we can easily double or triple that amount for a dog that has hemangiosarcoma. Hoochie, he would have been on this for sure. The number 5, talked about it a lot, the dewormer, fenbendazole, also known as Panacur. It hasn't been specifically studied for hemangiosarcoma. It's an old veterinary dewormer, limited to no side effects, very safe for animals, but it's now being repurposed as an anti-cancer drug. Not many conventional vets are going to see much use in it, but I know for sure if my dog were to be diagnosed with virtually any type of cancer, especially hemangiosarcoma, I would do a trial with Panacur as well. We know it's really safe. We know it's got some clear anti-cancer properties. It appears to be a microtubule destabilizer, meaning it's affecting the cell wall of the cancer cells, ultimately killing them. Will it work for your dog? I don't know. Do I think it's a pretty darn good thing to give in terms of being pretty safe? Big upside, limited downside? Yes, I do. That's why I definitely give it to my own dog. The regimen I would use is 3 days on, 4 days off, and the dose I would use is 50 milligrams per kilo, given once a day for 3 days. Meaning a 10-pound dog, they're 5 kilos. 5 times 50, that's 250 milligrams. That would be 2.5 cc's of the liquid Panacur, be given once a day for 3 days on, 4 days off. I do that for a full 30 days and then assess, is it helping my dog or not? So I really hope your dog never gets hemangiosarcoma, but if you have a dog that's been diagnosed with hemangiosarcoma, consider some of these alternative options. And if anything changes, new information comes out, i.e. a specific hemangiosarcoma cancer vaccine that's actually as effective, I'll definitely let you know. Thanks again so much for watching this edition of Veterinary Secrets of hemangiosarcoma in our dogs. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.